Good morning, everyone. My name is George Isham. I'm a senior fellow at the HealthPartners Institute in Bloomington, Minnesota, and chair of this committee. I'd like to welcome you all to this third open meeting of the Committee on Informing the Selection of Leading Health Indicators for Healthy People 2030. I'm joined by my fellow committee members, and I'll let them introduce themselves in a few minutes. Right after I introduce a member who's actually two members now who are joining us remotely. One is Ebony Bouwer, who's Professor of Medicine, Chief Division of General Internal Medicine in the Department of Medicine, and Vice Dean for Translational Sciences at Duke University. And then I think we have Darcy Phelan Emmerich, who is not with us, and she is epidemiologist, chief epidemiologist at the Baltimore City Health Department. See, I would have remembered that, but Alina helps me. And she at the last minute couldn't be with us, but will be joining us remotely, I guess, as well as will Ebony. So at this point, let's come around the table and have the committee members introduce themselves. And Paula, if you're ready to do that, start that off.
Good morning, everyone. I'm Paula Lance. I'm Associate Dean and Professor of Public Policy at the Ford School of Public Policy at the University of Michigan.
Good morning, everybody. I'm Gilbert G. I'm a professor in the Fielding School of Public Health at UCLA.
Good morning, I'm Martha Gold. I'm at the New York Academy of Medicine, where I'm senior scholar.
Carla Alvarado, Program Officer with the National Academies.
And Alina.
Alina Bachu, Senior Program Officer of the Academies.
And Rose.
Rose Martinez, Director Board on Population Health Public Health Practice here at the Academies.
Good morning, I'm Sherry Johnson. I'm the director of the University of Wisconsin Population Health Institute.
John Skinner, I'm a health economist from Dartmouth.
Okay, thank you. And so that constitutes our small but mighty committee. So really pleased that they're here with us. So the charge to our committee, this committee of the National Academies of Sciences, Engineering, and Medicine is as follows. The Department of Health and Human Services, Office of the Assistant Secretary of Health, requests that the National Academies of Science, Engineering, and Medicine convene an ad hoc committee to assist in the development of leading health indicators for Healthy People 2030. The committee will develop recommendations regarding the criteria for selecting LHIs, or leading health indicators, and a slate of LHIs that will serve as options for the Healthy People Federal Interagency Working Group to consider as they develop the final criteria and set of leading health indicators for Healthy People 2030. So that's the statement of our task. This statement of task is provided in on the attendee packet that has been available on the meeting page of the National Academy's website and in your attendee booklet as well. The committee will prepare two short reports, one responding to the first part of the charge pertaining to the criteria for selecting leading health indicators, and then the second responding to the second part of the charge, providing a slate of leading health indicators to serve as options for the Healthy People process. I'd like to note that this is an open and on-the-record session. We've allotted some time at the end of the meeting for public comment. And so I might explain at this point that the committee itself will be generating questions for the presenters. And if there is time, I'll go to the public, but it's primarily a meeting where we'll be doing that. Therefore, I will moderate the question and answer session at the end of each panel when we get to that point. So I would also like to remind you that as an information gathering session, that is, the committee is in the process of assembling materials that will examine and discuss in the course of making its findings, conclusions, and recommendations. So I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by questions, including members of the committee, should not be interpreted as positions of the committee or of the National Academies. In addition, committee members typically ask probing questions in these information gathering sessions that may not be indicative of their personal views. So this is very much a dialogue, very much an intellectual dialogue around this very important topic. And then the committee will then deliberate very thoroughly before writing its draft report after this process and a number of other meetings occur. Excuse me. Moreover, once the draft report is written, it must go through a rigorous review of experts who are anonymous to the committee, and then the committee must respond to this review by the experts with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the National Academy of Sciences presidents before it is considered an official Academy's report. So a statement about these issues are also included in the attendee packet. So that should give everybody present here a sense of a general overview of the process we're engaged in, of which this particular meeting is an important part. We are pleased to be joined today by several key individuals who are engaged in the Healthy People 2030 effort. And we'll first hear from Don Wright, who is Deputy Assistant Secretary for Health and Director of the Office of Disease Prevention and Health Promotion at the U.S. Department of Health and Human Services. We're also pleased to be joined today by the co-chairs and two members of the Secretary's Advisory Committee on the National Health Promotion and Disease Prevention Objectives for 2030. Each of them will moderate an expert panel, and each panel will be followed by a question and answer period that I will moderate. So that's a general overview of why we're here and our purpose and today's proceedings, and I hope that is helpful to everybody attending. So at this point, we're very pleased to have Don Wright with us today, who is Deputy Assistant Secretary for Health. And we're going to ask him for his comments and advice as we move forward. So why don't you proceed, Don? Thank you very much for being with us.